Joining me now in an exclusive interview is Waystar CEO Matt Hawkins. His company is hosting its True North conference in Nashville this week to spotlight potential new AI solutions in healthcare software. Matt, welcome. Setting the table here a bit, it's interesting to me. United Health, for example, has been having so much trouble lately, in part because of higher utilization and costs. I guess that's transactions, and that hunger for transactions is part of why you've been doing well?
Well, we're doing well. Thank you, John. It's great to be with you. I'm here at the Waystar Innovation Lab. We're beginning to welcome a sold-out True North client conference here in Nashville, and we're showing our clients how to utilize the power of AI to address higher utilization and do it with more efficiency than they've ever done before, while helping them get paid accurately, get paid efficiently, and get paid fully. So this is a very exciting time for us at Waystar as we have this sense of momentum.
So tell me about that higher utilization, though. I'm trying to understand for the whole sector how that's playing out differently for different players. I mean, I guess if you're a hospital, you want to be able to move things through quickly, get paid more quickly, more efficiently. But how is AI going to help with that?
Well, it's a fact that patient visits have increased, which is a major factor in utilization. Patient visits have increased an average of 1% to 2% a year for the last 40 years or so. It just so happens to be the case that in the last 2 years, utilization has been higher than that. It's been about a 4% increase. And so hospitals are having to do more with the same resources or less. AI is perfect in that case, where we can help automate low complexity, high volume tasks. We can help return more time to providers and give them more accuracy and efficiency as they work to address patient visits and then account for those as they interact with payers and then also with patients to get paid.
And then, Matt, is it potentially bigger than literal patient physical visits? How does telehealth, which had a bit of a spike and is now perhaps normalized, and things like Hinge Health, outpatient care that's still getting billed, though, how does that affect what you're seeing at Waystar?
You're exactly right, John. It absolutely includes more than just physical patient visits. It does include telehealth interactions as well as other virtual type Zoom interactions like the one we're having today. A provider can be very effective in interacting with a patient. Our software helps accurately account for that, helps the provider understand who the patient is financially, and then what we help assemble automatically using AI. Create a very accurate, perfect, undeniable claim that can then be rapidly submitted on our platform. We are creating incredible results for the clients that we work with and real ROI. We're in a situation where we're moving from AI hype and smoke, so to speak, to ROI-based reality as we help these providers interact with patients.
So, Matt, can your customers use this AI technology to explain to patients what they're paying for?
Yes. In fact, we are able, given that we process over 6 billion insurance transactions annually that constitute more than $1.8 trillion of insurance gross claim charges, we take all of that information and algorithmically can help patients understand, often pre-care, what their financial responsibility will be. That's a very consumer-friendly, far more transparency than the patient has had historically. And we're enabling providers to use Waystar software platform that's powered with AI to interact with a patient, help them understand their financial responsibility before they receive care in many cases, and then they can plan for their care. They can put a card on file, and in an integrated, elegant experience, then they can plan for and account for their care. We're helping to reduce, I'm sorry.
No, does the patient regulatorily have enough access to enough data to be able to do that without the provider's kind of permission? Understand the charges?
Well, in some cases, yes. There is a mandate for providers to publish their prices for certain healthcare services. That being said, each health plan is a little different. And Waystar's here to help bring simplicity and a common understanding to providers and create price transparency for patients as well. So we are really advocating for providers and patients, again, using powerful AI that is first to market, that is creating a real ROI for the providers that we work with.